dear friends. I am Dr. Banshi Saboo on RSSDI TV, live from Ahmedabad. Currently, I am President of RSSDI. Along with me, we have with us Dr. Rakesh. Rakesh is a Senior Executive Committee member of RSSDI, and he is also President-elect of Endocrine Society, which is going to take presidency in next month. So today in my presidential oration, I talked about diabetes, where we were, where we are, and where we should be. We were having diabetes, which is increasing from 1990 to 2016, that data we had shown. And then we had shown that how complications are more in our country. We have a typical thin fat Indian who is highly insulin resistant and having lot of complications of diabetes, which they develop almost 1 or 2 decades earlier than Western population. What we had talked that how we can have better access to diabetes care, diabetes health professionals across the country to improve the care for these persons with diabetes, and at the same time how we can prevent the diabetes in our country. Let us make our country a diabetes care capital of the world. But then the last part of my talk was on primordial prevention of diabetes. Is it possible that we can make our country diabetes free? If we see that we are highly insulin resistant, not from the in adult age only, actually at the time of birth, we have high insulin resistance. Our fat percentage is more than 25%, and the problem is the low birth weight child, which is only of 2.7 kg in compared to Western population, which is 3.2 kg. The fat percentage in the Western population is much less in compared to their muscle mass, and that continue throughout their lifetime. So this high insulin resistance is one of the important reason for us to have more metabolic syndrome. And then later on, they catch up with more weight, there is more abdominal obesity, and that leads to metabolic syndrome or early diagnosis of diabetes. Delayed diagnosis in our country is also a major contributor for more complication because bad legacy cannot be done undone. So in future, we would like to work across the country in rural part of the area to educate more people for the pediatric age group to correct their lifestyle and to make them more healthier in their early adult life, so they can delay their diagnosis of diabetes, they can delay the onset of diabetes, and definitely it can delay the prevention of the complication too. So with these few words which I talked about in my presentation, I would like to ask now Rakesh, what is your opinion that how we can reach out to this rural population where we can increase the awareness about diabetes, how we can improve their future, that we can prevent it primordially or we can prevent it completely, how we can have healthy lifestyle more, and as tomorrow is the World Diabetes Day and you are going to address the young Rotary group where you are going to talk that how lifestyle can be changed. So how we can reach out to these rural population, what is the best way, what you think as an
Thank you, Dr. Banshi. First, let me congratulate you on the excellent oration that you did today. Your oration was very informative and also very inspiring, and it inspired all of us to look beyond what we are seeing. When you're seeing a patient of diabetes, we are often looking only at the numbers in terms of his glycemic control and his blood pressure control and lipid management, and that's what we are looking at. But what you have shown us today is that we need to look beyond all this. We need to go beyond all this, try to understand where the problem has started. It is not that the problem has started just now when you have detected diabetes, but the problem has started many years earlier. And in fact, you have taken it one step ahead and said that it is right from birth that the abnormality has started, and that's where we need to address the issue. And just by looking only at, while we need to monitor, we need to definitely treat our diabetic patients very well. That is certainly required, but we need to look beyond. If we are looking at prevention and trying to change the numbers of diabetes in the years to come, we need to address these issues. We need to address them earlier. We need to look at proper nutrition and proper care, antenatal care during pregnancy. and then we need to educate the children during their growing years, and early and adults, young adults in their early years of life, when they can be, when they can change their lifestyle and make them follow a more healthy lifestyle, so that we can prevent diabetes. I think your uh, address today was very inspiring, and all of us need to work on these areas.
Because what we are seeing every time in IDF Atlas, every 2 years or 3 years when it comes, we see that this incidence and prevalence is increasing across the country. There is no way we are seeing that somewhere down the line it will decrease. And like last time the data was showing that every 6 seconds one person with diabetes is dying. Now this year in 2021 the data is showing every 5 seconds the one person is dying of diabetes. So diabetes is a deadly disease, the complications are so high. Do you think that in near future, even in the Western world, where the developed world is also could not reduce the incidence of diabetes, like they could do for CVD somehow, but not for the diabetes, do you think in near future, maybe down the line in 10 or 20 years, there will be a prevention of diabetes from the Western world, and then it may be followed up in the developing countries?
Yeah, as you have shown, the task is not simple, but certainly we need to look at this from a different perspective, not from the perspective of just looking at the patients with diabetes. And provided we do that, I'm sure we can make a difference in the years to come. But it is a tough task, and we need to address these issues, look at lifestyle of the entire population, not just the diabetic patients, and that is how it is going to make a difference. It's going to be looking at the family, the entire environment in which the person is living, and bringing about a change in that, so that we adopt a healthy lifestyle and start addressing these issues right from birth or early life.
So just to add at the end, as tomorrow is the World Diabetes Day, we want to increase the awareness, and this time we had come out with a Indian diabetes risk score in an app form, which will be available all across the country to all the doctors, all to the laymen also, and they can know what is the risk which they have for the developing diabetes. And one thing which we want, that diabetes can be prevented if they just check their risk score. And I want that each person who is at the higher risk of developing diabetes should reach out to the doctor, and then he should tell that how my diabetes can be prevented. That's one message which I want to give. And from RSSDI point of view, I just want to inform all my audience, all doctors, that this year we are also doing a dedicated research retreat meeting in month of March at Pune, where we are inviting all Indian scientists who have published their data in last 3 years. And that data they can come, they can send us, and we will invite them to speak about their data to the all RSSDI member or all Indian doctors who are interested in field of diabetes. So this program which we are going to do, which will be starting a new thing in our RSSDI as a research retreat in month of March. So I welcome you all for joining us for this research retreat also, and thank you for joining us on RSSDI TV. Thank you.
Thank you, Dr.